As I blogged previously, and check out that link in today's post, many people taking GLP-1 medication report a decreased desire or consumption of alcohol, but we've really been lacking clinical trial data to teach us more about this. A randomized controlled clinical trial of semaglutide 2.4 milligrams weekly, or Wegovy, is the first to show benefit to reduce alcohol consumption in people with alcohol use disorder and obesity. This was a small clinical trial of about 108 people. Uh, Half men and half women, average age 52, baseline BMI about 34.5, in Denmark, seeking treatment for alcohol use disorder, which is a disorder characterized by loss of control of alcohol consumption and compulsive use. And they had to have a minimum of 6 heavy drinking days per month at baseline. And so if you use 40% vodka to give context, that's equivalent to at least 6.4 ounces per day for men or 5 ounces per day for women. They were randomized to receive Wegovy titrated to 2.4 milligrams weekly or the maximum tolerated dose versus placebo. And this was alongside up to 10 cognitive behavioral therapy or CBT sessions. At baseline, people had an average of 17.2 heavy drinking days per month with an overall alcohol intake of 2,201 grams of alcohol, which is equivalent to about 236 ounces of 40% vodka per month. At 26 weeks, people in the semaglutide group had a 41% reduction in the number of heavy drinking days versus a 26% reduction with placebo. The mean total alcohol consumption per month decreased by 1,550 grams, which is equivalent to about 166 ounces of vodka with semaglutide versus 1,026 grams or 110 ounces of vodka with placebo. And an average number of drinks per day decreased by 3.5 units with semaglutide versus 2.1 units with placebo. The weight loss was 11.4% in the semaglutide group versus 2% with placebo. So these results are exciting for people with alcohol use disorders, but there are a number of caveats that we have to consider. Similar to what we see for the effective GLP-1 medication for weight loss, there was wide variability in response, with some people showing little to no reduction in drinking and others a huge benefit. This study was done with a lot of CBT support, which doesn't reflect the real world in most cases. Usually that kind of support isn't available. Many people with alcohol use disorder don't have obesity, and treatment with Wegovy would be limited to those with elevated weight in whom weight loss would be beneficial. On the other hand, lower doses of medication could also be studied to see if there could be benefit to reduce drinking without unwanted weight loss in those people. The study was done in Denmark in mostly white people, so studies are needed in diverse populations. The study was also small and short, and follow-up data would also be important to know if semaglutide needs to be continued to have the continued reduction in drinking. Based on what we know about the need to continue treatment to continue managing weight, I suspect that treatment would likely need to be continued here as well. Also, note that people in this study were actively seeking help for their drinking. So, we don't know if people not looking for help would spontaneously reduce their drinking with semaglutide based on these results. There are now many clinical trial registrations for other GLP-1 based medications, as well as other hormone based obesity medications under development, like amylin agonists for alcohol use disorder. It will be really exciting to see how this field unfolds. As a disclaimer, I am or have been an investigator in clinical trials of semaglutide, both Ozempic and Wegovy. I receive honoraria as a continuing medical education speaker and consultant from the makers of semaglutide, Novo Nordisk.